Welcome back. Today we're going to talk a little bit about a machine they use when they do brain surgery, at least the surgery that I had. And it's something they call a GPS machine. I don't know like the actual technical name, but when you have a tumor, the surgical team will get together and, discuss it, and they'll create an approach to your surgery, and they hook you up to a GPS machine that basically navigates a route to your tumor. Just like if you're using Waze or Google Maps to, go somewhere, it's a very similar type of a concept when they're getting to your tumor. And that was so fascinating to me. All of this is fascinating, clearly, and especially because I'm on the other side of it and I'm alive and all of that. But when they were explaining this to me, they said they had to route a way to get to the tumor. And me being a non-medical person, I was like, don't you just go up my nose and go through the bone and boom, the tumor is there? And they were like, no, it's a lot more intricate than that. It's a lot more detailed and complicated. So for me, my tumor was actually behind my pituitary gland. So if you're going this way through my nose, you'll hit the bone, two bones, you'll drill through them, and then you'll hit the gland. And they had to cut through the gland and actually remove a third of it and then get to my tumor. There was no way for them to kind of bypass removing part of the gland. Now, I don't think that's true for everyone having this type of surgery, prolactinoma surgery or pituitary surgery, where they have to remove a piece of the gland. I think it matters where the tumor is in that pituitary space. I don't know if that's the word for it, but basically your tumor can be in many different places. You can think of it like that. It's not just one place that it's in. And when they're, starting the surgery, or before they start the surgery, when they're prepping your body, they hook you up to this GPS machine. And I didn't know going into it how I was going to be hooked up to it, because as the patient, when you're going through this and you're preparing for it, you hear the doctors explain things, but sometimes it'll go in one ear, not the other, because you're just like, just keep me alive, But they hooked me up to this machine through my ankles, and I still have scars, or these little, they're not really scars, these little pin points in my ankles from where they hooked me up. And I didn't notice that until after I got home from the hospital, because the entire time I was in the ICU, I had these compression socks on, and then I had the, what's the name of it? It's basically like a blood pressure cuff for your leg, and it squeezes and releases to keep blood flow and blood circulation in your body. Because when you're in ICU, you're not doing much walking around, you're just laying there, and they don't want you to have a blood clot. So they keep these compression devices on your legs. But underneath that, I had compression socks. And so that was covering my ankles. And also, I think I talked about this in a previous video, but when you're in ICU, you don't shower. Like you don't have access to a shower. You can shower when you're in a regular room, but for me, I was in ICU the whole time. So, the nurses would come and like wipe you down and stuff, but that's pretty much it. So I had those compression socks on for 3 days. So when I got home, and I finally took them off and I got in the shower, I was looking at my ankles and I was like, what are these like pinpoints in my ankles? And, when I had my first follow-up appointment, I think a week later, I asked my surgeon and he was like, oh, that's where we hooked you up to the GPS machine. And it was fascinating. So I think this one machine, don't quote me, especially if you're, a medical person, but I think this one machine has a dual purpose, or maybe there's two different machines, but one is the GPS aspect, and then the other is to monitor your body's electrical system. And so basically, if I were to have a stroke in the middle of the surgery, I'd be hooked up to this machine that would tell the doctors, something's going wrong, she's having a stroke, she's having a heart attack, whatever, and it'll show exactly in my body where this issue is happening. So they could pause the surgery and then address, the stroke, heart attack, whatever. Obviously, I didn't have that, but if that were the case, and it's very comforting, especially being on the other side of it. I wish I would have I don't know if I wasn't paying enough attention going into it as to everything he was saying, but I mean, you're so stressed that it's it's damn near impossible to try to remember everything. So, but now that I'm on the other side and I'm learning more, even to this day. I mean, I'm a year and some change post-op, and I'm still learning things about what they did. And I sometimes it's a little bit overwhelming, where I'm like, wow, they actually drilled through this bone and they hooked me up to this machine to make sure that, if something were to happen, they'd know immediately. But anyway, so as they're operating, they're looking at a monitor, and that monitor is kind of guiding them on the route that they need to take. It's like looking at Waze. I mean, it's so crazy that they can do this, and the technology and all of that. So they're kind of like following the directions, and you know and they also were telling me that sometimes they'll get to a place where they can take a break, because I was like, were you all operating straight for 8 hours? I can't imagine that, because they told me the size of the space they were operating in was the size of a Cheerio. I mean, it was a very small space, and there was very little margin for error because, and again, I talked about this previously, your carotid arteries are on either side of your pituitary gland. So if you nick that artery, he told me if they nicked the artery, there was a 50% chance that I would not come out of the OR and I would basically bleed out. So you're operating in a tiny space, you have little to no room for error, and it's a long time. And, they explained to me, I had two primary surgeons. I had a neurosurgeon and an ENT, and they would they would work collaboratively, but there were some parts of the surgery where one of them would be like kind of taking over. The other one could kind of rest for a little bit, if you have to use the bathroom. All those questions I was having, I was like, what if you have to pee? Like, what if you're operating and you sneeze? Like, how do you prevent yourself from doing some of these things? But, they kind of they have a game plan for your surgery. And so they can tell themselves, okay, when we get to this point in the surgery, we'll, take a break, or one person will take a break and, come back and like that, so that they can do it successfully when it's that long, And also for my surgery, they estimated initially that it was going to be about 5 hours, but it ended up being 8 hours because I had a little bit of a complication. I started bleeding a little bit too much. I think it's called a venous lake. If there's any medical people listening and this sounds right, then maybe you can explain it a little better. But it was something called a venous lake. I don't know if that means like the blood was pooling somewhere, but they needed to kind of pause the surgery and deal with that, get that situated, and then go back to the surgery. So, that's why mine ended up being a little bit longer. And yeah, but they used this GPS machine, and they were monitoring my body's electrical system the entire time. And I didn't have any other kind of complications. My body reacted really well to anesthesia, all like that. So yeah, I just think it's beyond fascinating. And I still have these marks on my ankles. I don't know if they'll just be there forever, but they just look like little black dots pretty much. I mean, it's not that big a deal. And I kind of, in a strange way, I kind of like it. It's like a little souvenir that I have from surgery. Now, if I had like major complications and all like that, I probably would have different feelings toward having any kind of mark on my body or any kind of reminder that I went through this. But because this experience was as positive as it could have been, I'm grateful for those little reminders. There are times where I'm still a little bit emotional about it, but there are other times where I'm like, damn, I went through this, I survived it. I'm a completely different person on the other side. So yeah, I'll wear that little scar with pride. So yeah, if you have any questions about that, or maybe any other tools or equipment, anything like that they use, feel free to ask. I know a decent amount about it. I mean, I don't know all of the technical names for these things. I'm like, oh, they use a drill, or they use a scalpel, or, I'm not a medical person, but I've done a good amount of research for this surgery. So yeah, that's one of the tools, one of the machines they use for brain surgery.